enter to my patient's room, I perform hand hygiene, provide privacy, introduce myself. Hi, I'm Manila and today I'm gonna be your student nurse. I'm gonna check you from head to toe. So can I have your name and date of birth?
Sagar Pant, 21 March 2001.
Okay, that's correct. So I'm gonna check you from head to toe. That is, I'm gonna see if there is any abnormalities on the skin or like in your respiration or anything, so we can further discuss what is going on.
Okay.
So do you agree with the procedure?
Yes.
So I'm gonna check his vital signs, that is his blood pressure, oxygen level, respiration, temperature, and his pulse.
Okay.
So let's begin with the assessment. So my patient is sitting good, there is no lumping or anything, he's in good position and quite healthy. And moving on, I think his hearing and speaking is good. He can hear what I'm saying and he can answer what I'm asking him. His body appearance is quite good. I cannot see any alcohol abuse, drug abuse, and his hairs are quite good. And his nutrition status, he looks quite good and healthy. So how do you do your groceries?
I go by myself.
Okay. Do you have anyone to eat with you?
I got my family.
Okay.
Yeah.
Do you cook by yourself?
Yes.
So I can say he's quite healthy person and he has family to eat with. So for the gait and mobility, I cannot see any wheelchair, crane, or walker. Can you please stand up and can you walk for like 2 steps? Yep, his mobility and gait are quite healthy. So moving on, I'm gonna check his like scalp and his lymph nodes and his so his scalp looks healthy. There's no wound or anything, and his lymph node or node is not palpable and it is quite good. Okay, so can you look at the wall?
Okay.
So I'm gonna check his parallel. Okay. Okay, his pupils are bilaterally dilated. Now, can you, without moving your head with your eye gaze, can you move this? Can you follow the direction of the pen?
Yep.
Do not move your head, please. Okay, so his gaze is quite good and I cannot see any abnormalities or anything. So now let's move on, check your ears, okay?
Okay.
So up and back. Do not move your head. Up and back. Okay, let's say his temperate membrane is well intact. There is no detach or anything. I can see his serum, it's yellow to orange. His ears are good, it is intact, there is no wound or anything, and it matches to his face skin. Okay, so I'm gonna inspect your nose, okay? Okay, so his nose, there is no deviated septum. I cannot see any foreign object or any discharge of mucus or any membrane, so it is good. So can you open your mouth for me? Can you take your tongue out? Okay, can you give me a second? So all this I'm wearing gloves. So can you tongue? Can you say Okay. So his vulva is in the center, his tonsils is +1, and I cannot see any infection in his tongue or anything, and I cannot see any wound or anything in his like cheek area, buccal membrane. Okay, so can you smile for me?
Mm.
Can you puff your cheek?
Mm.
Okay, so there is his muscles are bilateral symmetry and it is moving on both sides, so I don't think he have any paralysis, stroke, or anything. Can you take your tongue out? Okay, his tongue is out and he's moving. And can you touch your nose? Can you touch your chin? Yep, that's good. So I cannot see any abnormalities or anything. So can you shrug your shoulders?
There you go.
Okay, I can feel the pressure bilaterally on both sides. So, are you feeling any kind of pain today?
Yes, on my hand, on my wrist.
So, can you tell me what is making it worse or what is making it better?
It's because I was using computer a lot,
Mhm.
so I'm having pain in my wrist.
Okay, so can you tell me what kind of pain it is? It is aching, throbbing, or like stabbing kind of pain?
It's like a throbbing pain, and it is radiating right here.
Okay, so
Yeah.
can you tell me its region where it is, and is it like spreading to other area too?
Yeah, it is going up to my elbow,
Mhm.
this side, and it is like radiating through here.
Can you tell me from range the severity from 0 being the least pain and 10 being the severest pain you have been feeling and 5 being like a moderate pain?
I'll say 3.
Okay. And can you tell me like how is it? It is like continuously aching or it is stopping and aching?
It is like stopping and eating. While I'm using computer, it is eating a lot.
Mhm.
Or while I'm out of my computer, it's just not aching.
Okay, that's
Yeah.
good. So moving on, let's go with the respiration, okay?
All right.
So till now, I have watched his respiration, and his respiration is unlabored. So I'll ask him to take out his like front gown.
Mhm.
Can you?
There you go.
I think I need to take.
It is on.
So I can see his front chest part. There is no scar, wound, or anything, and it is symmetrical bilateral. So now I'm gonna listen to his respiration. Okay, so just keep on breathing, okay? Okay, so I'm gonna do the back side now. So his back, I cannot see any scar or anything, and it is like symmetric on both sides. So I'm gonna do. Okay, can you take a breath? Okay, so I cannot hear. So his respiration sounds normal. I cannot hear any wheezing, stutter, or crackles. So I'm gonna do a little bit kind of taste. So tell me if you kind of pain, okay? Yeah. Do you feel any kind of pain?
No. No.
Okay, so he doesn't have any kind of CVA tenderness. So moving on, let's go with the cardiovascular. Let's go with the heart, okay?
Okay.
So I'll check for his pericardium and his neck vessels. So he has no anything moving or anything. Okay, so I'm gonna listen to your heart. Okay, so I can hear his S1 and S2, which is normal, and I cannot hear any abnormal sounds like S3 and S4. So now I'm gonna listen his for apical for like around 1 minute. I did it wrong. Excited. his everything is normal, so I'm gonna listen for 30 minutes. If it's any irregular or anything, and then I'm gonna listen for like whole 1 minute. So now I'm gonna compare his PMI and his radial pulse now. Can you extend your hand for me? I have to draw it. So I'm gonna do it here. Yep, I found it. Okay, so both of them are breathing symmetrically. There is no abnormality or anything, and his pulse is like +2. Oh yeah, I need to check your cardiac arteries with a bell. So can you take a straight look? Okay, so I cannot hear any murmurs on it, so that's good. So now can you give me a hand? Now I'm gonna check his capillary refill. Okay, it is less than 3 seconds, and like there's no clubbing of the fingers and no cyanosis. The skin sugar is good, so he is not dehydrated or anything. So can you squeeze my fingers? Okay, so can you pull and push? Can you pull? Can you pull? Okay, so his straight is 5.5. So I'm gonna move for his now gastronome, like stomach area. So can you lay back?
Yeah.
So I'll make sure that his only stomach area is like exposed. Okay. So I cannot see any scars, wound, or masses in his stomach, and it is like symmetric. The umbilical is in center, and everything is good. So I'm gonna now escalate his stomach. So let's start with lower quadrant. Okay, so so his bowel movement is hyperactive, and I cannot see any normal. So I'm gonna palpate slowly, lightly, and if you feel any pain or anything, you can tell me. Okay?
Okay.
Do you feel any pain?
No.
So that's good. So do you know when was your last bowel movement?
Couple of hours ago.
Okay, and do you have like any abnormality right now with the bowel or anything?
No.
Okay, so if my patient was female, so I will ask her when was her last menstrual period. So moving on, I'm gonna check his like peripheral. Can you remove your socks and your?
Yep.
Just one feet is fine.
Yeah.
Your socks too?
Okay. Yep.
So I cannot see any ingrown toenails, any wound or anything, and I cannot see any edema, so it's none. Now I'm gonna check for his like his pulses. Okay. on his pulses, and I can say it's good. +2. And now I'm gonna check for the patella. His reflexes. Okay, so his reflexes is working. I can say it's +1. Yep, both sides +1. So I'm looking at his skin color, and I can see his skin color matches to his race, and his skin is warm in touch, and his capillary refill is within like a 3 seconds. Yep. Okay, so can you once lay back? Okay. Can you go back? Okay. Okay. So can you push my finger? My hand? Yep. Can you pull it back? Yep. His strength is up on 5 on a 5.
Okay.
And this brings our end of like head to toe assessment.
Alright, thank you.
Okay. So, yeah.